The third part of this presentation on tracking the progress of the stroke survivor's recovery journey looks in more detail at the proposed Stroke Quality of Life Survey. In particular, it looks at the structure and procedures of the survey and at what actions can be initiated automatically or manually with the stroke survivor's responses to the survey. I will now briefly outline the procedures which could determine when and how stroke survivors would be asked to complete the Stroke Quality of Life Survey. Firstly, the Stroke Quality of Life Survey should be completed as part of the hospital discharge process in order to establish a baseline for subsequent monitoring of community-based recovery. Then, the Stroke Quality of Life Survey should be completed periodically according to a planned schedule, which might be several times in the first 6 months post-discharge, then every 3 months up to 2 years post-discharge, and then every 6 months until a satisfactory quality of life is achieved by the stroke survivor. The Stroke Quality of Life Survey should be completed using the Stroke Rehab app on an iPad or an equivalent application running on a desktop or notebook computer. But to ensure that most, if not all, stroke survivors can complete the survey, it is important to provide a number of options, such as individual stroke survivors using the iPads issued to them on discharge from hospital, as described elsewhere in these presentations. Stroke survivors could be assisted by their carers or family members if necessary. Members of community-based stroke support groups could complete the survey on behalf of other members who don't feel confident enough to use the iPad app. Members of staff at subacute hospitals could complete the survey on behalf of past patients. Stroke liaison officers employed by the National Stroke Foundation could complete the survey on behalf of their clients. Community health centre staff or community-based therapists could complete the survey on behalf of their patients. Or GPs or staff at medical clinics could complete the survey on behalf of their patients. Once the Stroke Quality of Life Survey has been completed, there are 2 opportunities to analyse the stroke survivor's responses. Firstly, survey results could be analysed immediately in the iPad itself using local rules defined by stroke specialists. These local rules could trigger local workflows, including explanation workflows that provide specific information in the form of videos, podcasts, or books that are relevant to a specific response. For example, information relevant to a stroke survivor who is concerned about his or her ability to make decisions. Then there may be testing workflows that provide standard tests of specific abilities that can be administered using the features of the iPad. And there are response workflows that define specific actions depending on choices made. For example, stroke specialists may want to establish a video conference call with the stroke survivor if they respond to a particular question in a particular way. Secondly, when survey results are sent back to the central database, they can be analysed using additional central rules defined by stroke specialists. These central rules could trigger central workflows, including automatically advising treating therapists of significant changes in a stroke survivor's responses, automatic referrals to stroke specialists for further interpretation of responses and appropriate actions, the suggestion of changes in therapies or therapists based on accumulated knowledge stored in the stroke recovery database, or the suggestion of the need for therapist appointments or video calls. Furthermore, survey schedules for individual stroke survivors could be maintained on the central database and reminders issued automatically to survivors and/or the people who are nominated to help stroke survivors complete the survey. Finally, over time, survey results will build up a comprehensive stroke recovery knowledge base containing invaluable information for healthcare administrators in both hospital and community settings, therapy, research and development scientists and stroke clinicians, and medical profession educators. I will now go briefly through some of the ICF codes included in the Basic Learning Abilities section of the ICF framework to illustrate the sorts of disability items that will end up in the Mental Abilities section of the Stroke Quality of Life Survey. For example, we have the disability item called Copy Things, which corresponds with ICF code D130, or the ability to imitate or mimic, such as copying a gesture, a sound,